let's talk about some of the risk factors. Let's talk about high blood pressure. What's a normal blood pressure?
Well, it kind of depends who you ask. That's an interesting question. We used to say 140 was high blood pressure, but a lot of people now are focusing on 130 on the upper number, the systolic, or 80 on the lower number, the diastolic, as being the threshold at which we should start thinking of as high blood pressure.
So if somebody walks into your office, they're 10 pounds overweight and their blood pressure is 145 over 72, and they say, well, Doc, I just rushed in here today. My blood pressure is normally better than that. What do you tell that patient?
Well, there may be some truth to the I just rushed in here, because we don't always measure blood pressure as accurately as we should. And we want people to check their blood pressures at home, and we want to recheck them in the office and let them rest and recheck. But the first thing I tell that person is start being more physically active, cut salt and sodium down in your diet, and especially if you can lose some weight, that's going to help that blood pressure.
So those things will help reduce the blood pressure. Why does the high blood pressure make people have a heart attack or stroke?
Well, because the heart has to pump against the pressure in the arteries. It's just like pressure in your water pipes. The heart's a pump. And the more pressure there is in the pipe, that's the blood pressure, the harder the heart has to work.
So the heart has to work harder, it needs more nourishment. If the blood vessels are not doing what they should to nourish the heart, you can have a heart attack. How about stroke, the ischemic stroke that you talked about?
Okay, ischemic strokes occur because something closes off an artery going up to the brain, and blood flow to that part of the brain is lacking, and that causes damage. And high blood pressure and smoking are probably the biggest risks for having stroke. And we know that if we can lower the blood pressure, we reduce the risk of stroke.
Are there good medicines in lowering the blood pressure?
Oh, we've got all kinds of medicine. I tell people regularly, we'll get your blood pressure down. Now, we may have to navigate and switch off depending on what side effects you might experience, because any medicine can have side effects, but almost always we can get the blood pressure down with minimal, reasonable side effects.